I'm Jeff Peacock. I'm with Southeast Pain Care and part of Blue Ridge Spine Center, and I've been practicing now for about 4 years, not including fellowship training. But my specialty is interventional chronic pain management, and what that is it's a combination of a lot of different fields that go together to treat people with pain. And we kind of treat everyone with acute pain to more chronic issues, and the chronic issues are generally thought to be after about 3 months of kind of having pain. And what we do is we try to integrate a multimodal approach to try and help people succeed and minimize pain and improve their quality of life, really. And to try and do that, we do a combination of interventions, so injections, targeting neck pain, back pain, joint pain, and other areas as well. We do medication management, and then we also help coordinate and make referrals to other physicians, and hopefully that's something we're going to be able to do even easier with the Spine Center as we try to develop it moving forward. Well, I think in some ways it certainly helps coming to us first because we can coordinate care easier. Generally, surgeons like to do surgery, and so by the time they see the surgeon, the hope is that it's someone that needs surgery. A lot of times people don't know where their pain's coming from, and so one of the things that we can help do is identify where the pain's coming from. It's hard to treat pain until you're sure it's of its location, and so by coming to a pain clinic, we can try to identify where your pain's coming from and then try to provide relief. And there are different avenues, like I had mentioned, to try and treat pain, and we do hopefully do a good job helping coordinate that, whether it's physical therapy, whether it's chiropractic care, whether it's images that need to be done, whether it's things like back bracing or yoga. We hopefully can offer all those things. And then, when the person needs to see a surgeon, we can also try and coordinate and get them in with the right surgeon to take care of their pain as well. As we get further and further into treating pain, people have come to realize that no one treatment option by itself does well at controlling people's pain long term. And so you need a lot of different modalities involved, whether it's injections and medications, core strengthening, physical therapy, rehabilitation, chiropractic care, and ultimately maybe surgery. People do better if they're targeted from many different perspectives to try and control pain. So hopefully what the Spine Center is it's a multimodal approach that allows us to coordinate care between all those different modalities easily. And so although at this point we don't have one physical building with all those treatment options under one roof, what we do have is a buy-in from a lot of the physicians here locally that have similar feelings on the care for chronic pain that allowed us to coordinate the care between those different people very easily and very quickly, improving the patient experience, hopefully decreasing waiting times, and allowing for the patient to get what they need quicker and hopefully improve their pain in that way. I think our team's great. We've all been together now for a couple years, pretty stably. The nurses, the admitting staff are all very sympathetic to pain and actually do a good job identifying pain generators sometimes before they even get back to me. That's how comfortable they've all become with pain and where it comes from. They all seem to have positive attitudes and are very empathetic to our patients. They love treating patients, and that's what makes it a good place to be. I have an anesthesia background. In anesthesia training, we did a lot of different specialized injections for surgeries, but I really missed interacting with patients. And so by going back and doing interventional pain, it allowed me to continue to do a lot of those interventional procedures that I really enjoyed, but let me really establish those meaningful relationships with the patients. And so I enjoy seeing people do better and improve and see their quality of life improve and see how grateful they are. And that's, why I chose to go back into pain, is to try and, reestablish that relationship with the patients. In back pain, there's a lot of different places it can cause pain. Sometimes it can be a herniated disc or people to have what's called stenosis, where they get back and leg pain. You can a lot of times get arthritis that builds up throughout the spine as well that causes back pain, pain when you walk, pain when you move. And to try and differentiate between those different pain sources is very important because the treatment becomes different. The best things you can do are get on the pain early. If you're having issues with pain, don't wait for it to be 20 years down the road. Don't look for a quick fix. A lot of it comes down to strength, range of motion, flexibility, staying active, and again, identifying the pain. If you can figure out where the pain's coming from early, treat it appropriately, the hope is that it doesn't become a lifelong burden and you're able to improve and get on with the things you want to do in life.